The Santa Fe group is an eclectic mix of highly individuals that are creating an incredible dynamic and have over a number of years by having very different perspectives that they bring. There's a diversity in professional backgrounds. There's certainly a diversity in opinions about important matters that weigh on the health of the public, on the dental profession, on the dental business. And no one is shy about expressing their opinions. And so there's a nice sort of, oftentimes a clash of opinions, but it creates sort of a cauldron of bubbling, ideas and interests that every now and then actually turns into something practical and useful. So the word think tank is sort of a little bit, I think, extreme view. It sort of sounds so official and high and mighty. And the word salon, which we had used at different times to describe our gatherings, all this tends to have sort of a bit of a high and mighty, elitist sort of perspective. Interestingly, though, I think both of those terms can be used to describe what we do and our meetings, in that we really do try to bring together, as our group does, as a group, a diversity of views, a diversity of perspectives on what we believe are important, highly topical issues that, again, affect the health of the public, and which we feel that our profession of dentistry can make a major impact in. I think the research that we have is clear in understanding what are the, at least in regards to periodontal disease, what are the major predictors of periodontal disease and periodontal breakdown. And I think the research is becoming clear as to how periodontal conditions can actually affect general health and well-being in important ways, particularly in an aging population. I think, if anything, we know that prevention works, and prevention is probably the best way to manage problems. That can mean both preventing the occurrence of disease, but as importantly in an aging population, preventing the progression of prior existing disease. So I think the research shows that we know how to prevent disease and control it, and I think the challenge is providing the services to those who need it in a practical and cost-efficient way. So I think if there's one area of research that is lacking still, is in the area of health services research. Not so much the biological or biomedical causes of health and disease in older people, but more importantly, how to most effectively bring known, proven, evidence-based modalities of interventions to those who are most vulnerable and need it most immediately. So in the area of health services research, comparative effectiveness research, those sorts of areas of research that typically are not the sorts of things that people think of as research. It's not laboratories, it's not cells and molecules. It's actually working in the real world on real populations that face a very complex set of problems. That's where I think the most fruitful avenues of research are. I think one of the interesting things that we reflect on as we look back over the decades, there's been clearly a tremendous improvement in the health of Americans, in the health of all Americans, if you look at an average. Whether you're young or old. In the case of older individuals, we've seen that teeth are being retained. Older people have more teeth on average over time. Fewer have full dentures or fully edentulous. But if you look underneath the average to see what actually comprises the average improvement over time in the US, you begin to see dramatic disparities, that certain population groups are just grossly disproportionately burdened by disease. And those particular groups tend to be those that are older, poor, suffering from disabilities of various types, and also that are members of racial and ethnic minorities. Those are groups that are disproportionately affected by the burdens of disease, and we call health disparities populations. In that setting, it's interesting that one would think that what makes those groups different are just purely socioeconomic status factors, such as their family income, their access to insurance, their levels of educational attainment. And in fact, those things are important predictors. But once you do what epidemiologists would call the best control analyses, even then you see that certain racial and ethnic minorities are still disproportionately affected. That, for example, poor blacks or poor Hispanics suffer worse in regards to mouth conditions than poor whites. And in that regard, there's a need to better understand the cultural perspectives that different folks bring, different populations bring in regards to their own behaviors. But I think as importantly, the kinds of cultural perspectives that the care system may bring. Is the care system providing a warm, respectful, and accessible means of health care, depending on the makeup of who are the healthcare providers. So I think there are ways to work on both the behavior of the populations, but also on the behavior of the providers, and in some ways changing the kinds of providers that we have available to take care of those most burdened by disease should certainly be a priority in any discussion about needed change. The conference is doing, I believe, and has these Santa Fe Group conferences done before, it's a form of consciousness raising. I think at the level of the conference itself, I think what we find is that many individuals who attend the conference have their conscience raised as to, we are all on the same page. We may come from very diverse backgrounds, professional backgrounds, have different interests, whether from the not-for-profit sector or in the for-profit sector, and really feel that we are all identifying similar problems, and gosh, the solutions are not really that much different in our different groups. So I think that by itself should be a catalyst for individuals who go back to their home institutions, their home bases, their professional circles, to begin to further raise consciousness in their peers that there are other like-minded folks around who recognize a problem and can come together from diverse backgrounds towards solutions. In regards to the specificity of what the solutions are, what the most proximal next steps are, I think clearly has been identified so far that providing individuals with adequate health insurance benefits is key. And that the so-called benefit systems or benefit plans or reimbursements need to be in sync with the sorts of incentives we want to have in place to achieve good health care and in turn good health. So I think there are already some, creative ideas that are being discussed and were being raised that we should very actively ensure that oral health care coverage is part of any national health reform and the priority that we need to put on that, and that existing systems of healthcare reimbursement be modified to ensure the kind of crosstalk and cross-referral between dentists and physicians, the involvement of nurses and other healthcare professionals in providing oral health for older Americans. I think the other things that we learned from the Santa Fe Group meeting is that it's a form not just of conscience raising, but it's a form of friend raising. I think we wind up creating nice collegial relationships where none may have existed before, or we promote existing ones and sort of bring them to a higher level. And then the other part is fun, F-U-N, fun raising. I think we find ways that we can really enjoy one another's companies, and even though we find time to enjoy ourselves socially, we're also really focusing very, very hard, working hard on important and challenging issues. But we can do it in a very productive and collegial way.